Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters on ITV, organized by the Islamic Medical Association of South Africa. Bismillahir Rahmanir Rahim. We will begin with the tarbiyah, the medical benefits of Salah, the postures of the prophets. In the name of Allah subhanahu wa ta'ala, the beneficent, the merciful, the great and glorious Allah, upon whom the great and glorious Allah does not insist upon the performance of any person. I think what is important to understand is that Salah is something that one has to perform, and it is insisted upon the performance of any other devotion as much as he does on the performance of Salah. Hazrat Khaja Gharib al-Nawaz radiyallahu anhu. The word Salah in Arabic is translated as prayer or worship, and also supplications for forgiveness of Salah. I think it's important to understand that Salah not only provides an opportunity for exercise, but it's also an opportunity for devotion, for the spiritual connection. And there are certain opportunities which one needs to engage in prayer or worship, and also supplications for forgiveness, compassion, and mercy. The term in Persian, Turkish, and Urdu is namaz. Without performing Salah, none can approach Allah subhanahu wa ta'ala, because Salah is the climax in the process in such approach for the pious. Salah is at once an external and an internal practice where there's physical exercises and spiritual nourishment. It is performed 5 times a day, and this is aligned to the planets and the heavens. By performing Salah, one becomes harmonized with all of the natural cycles of the universe. The Salah is done by assuming 7 separate positions of the body called arkan. In the course of one day, the minimum performance consists of 71 units with 7 postures. This translates to over 1 million postures in an adult lifetime of 40 years. The ailments people experience in the Salah are mainly concerned with distractions, both physical and mental. One is often distracted by noise. In this instance, it is better to perform Salah in a closed, secluded room, or even close one's eyes. The second cause of distraction, the best way is actually to think of or consider that you are watching Allah subhanahu wa ta'ala and that He is watching you. And ihsan, to look at ihsan, that this will increase the concentration, and an effort to develop this quality of ihsan in our Salah will ensure ongoing process of obtaining closeness to the Almighty Allah. Tonight in our studio we have a guest, a private practitioner, a dermatologist, a specialist dermatologist, Dr. Yunoos Omar, who has been in private practice for over 30 years, and the topic of discussion is acne. We're going to be looking at causes, treatment, effects, side effects of acne, but we would like to now ask Dr. Omar, what is the incidence of acne?
Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to just mention the broad anatomy of the skin. As you may be aware, the skin is the largest organ in the body, which has its own blood supply and nerve supply. If you can have the first slide, please. If you look at this cross-section of the skin under the microscope, you will see the structure with the epidermis, that's the top layer, and then the deeper layer is the dermis, and then of course the subcutaneous layer. The obvious structure there is the hair follicle, with the attached sebaceous gland. And also you can see the blood vessels, both the arteries and veins and the nerves, and then the fatty layer at the bottom. Now, to come back to the subject of tonight's discussion, we are talking about acne, also known as acne vulgaris. And just to give one an idea, unfortunately we don't have statistics in South Africa that are with any studies that have been done on the actual incidence, but we can extrapolate from the figures in the United States. There are in the United States 40 to 50 million individuals suffering from acne.
Look at the camera.
And of these, the majority of them are in the adolescent age group, teenagers and young adults. And of these patients, 85% are teenagers, in fact. So this is probably the same experience is in South Africa, but we don't have the statistics available as such. A lot of misinformation is prevalent about acne and its treatment and so on, and this will be borne out by some of the questions that we have received on the email about acne. Yeah.
Dr. Omar, just regarding the causes of acne, what are the common causes of acne?
Well, look, first of all, it is very surprising to note that we cannot actually say what is the exact cause of acne in this day and age and after seeing so many of these patients. But there are certain factors that are involved in the development of acne. And these are, number one, excessive oil, also referred to as sebum. And this is, I mentioned to you about the sebaceous gland on the microscopic picture. That would show, that is where the actual sebum is produced in that gland. Also, so the one factor is the excessive oil. The second factor is the clogging of the pores. The third factor is a bacteria specifically involved with this called Propionibacterium acnes. I'll use the abbreviation P. acnes. And last but not least, it's the ensuing inflammation that occurs. Now, the actual sebum, we all know that to keep our skins nice and soft and oily, the sebaceous glands secrete the sebum and it is pushed out onto the surface of the skin. But during adolescence and puberty, there's an effect of androgens, which is a hormone which causes sebum production to go into overdrive. And you get a large amount of sebum appearing on the skin, or appearing from the gland and trying to push out onto the surface of the skin. A large part of it does get onto the surface, but being such a quantity, you do get blockage in the actual pore. And this is where the problem starts. Once you get that blockage, the bacteria that I mentioned, the Propionibacterium acnes, will thrive in this medium of oiliness or sebum, and this will result in inflammation. So it's the clogged pores, the excessive oil, and of course this bacteria. Now, what does this inflammation actually do? A lot will depend on the level of the inflammation. As I showed you on that initial picture, there are various levels at which this blockage can occur. If it occurs in the very superficial area close to the surface, then we get what is referred to as a blackhead or a whitehead, depending on whether it's an open, whether there's an opening or whether it's closed. If it occurs slightly lower, then we call that a papule or a pimple. And if it's slightly deeper, then it becomes a pustule. And of course, once it's really deep down, the inflammation is quite severe, and this results in a cyst, what we refer to as nodular cystic acne. So that is basically the mechanism by which acne comes about.
So you're basically saying that the cause of acne is excessive oil in the sebaceous glands. But you also mentioned puberty, talking about the hormones affecting or contributing to acne. So is acne confined to a specific age group, or would you say that acne could occur in older people as well?
Well, by and large, as I mentioned in the figures at the beginning, we noticed that the majority of patients are in the adolescent age group. However, you correctly say that it can occur in the elderly, and this is based on hormone imbalance, etc. So acne is not confined specifically to any particular age group. You can even get so-called infantile acne and neonatal acne, which is like occurring in the first week of life and in the first few years of life. But these are all rare manifestations of acne.
And what would you advise patients on caring for their skin, patients who are suffering from acne?
Well, this is quite important because, you know, a lot of patients come to you and say, you know, doc, I'm scrubbing my skin and I'm washing it vigorously, but I'm not getting better and it's not cleansing it. But in fact, excessive washing and scrubbing can irritate the skin and cause your acne to worsen. What we recommend is that you do gentle washing with lukewarm water twice a day at least, using a gentle cleanser, and also try and use a shampoo for the hair, especially if somebody has got very oily hair. But this would be a general approach, and not, you know, what most patients will do is try all these fancy cosmetics, etc., but we can come back to that at a later stage. So the whole emphasis is on gentle cleansing.
Okay, we will take a short ad break, but before we go into our ad break, I would like to remind the viewers to please feel free to call in with your questions on 011 086 7701. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We have in the studio, our guest for today is Dr. Yunoos Omar, a dermatologist in private practice, and the topic for discussion is acne. Dr. Omar, we were talking about acne, and I would just like us to look at factors that trigger acne or that can contribute or perhaps aggravate acne.
Okay, a very common question that one gets in practice is patients want to know about diet. What foods should I eat, and what foods can aggravate my acne? Now, just to put the record straight, acne is not caused by any specific foods. Although some patients will tell you, or some individuals would say that when I eat this, my acne worsens, or when I eat that. But double-blind clinical trials have shown that no specific foods are the cause of acne. And we advise patients who complain about certain foods to avoid those foods But the other factors that are also involved in triggering of acne. There's genetic factors, hereditary factors involved, and here you usually find that there's a strong family history of acne. Of course, you can't do much about that, excepting that you have to choose your parents very carefully. But secondly, there are some hormone effects as well. Androgens can affect the onset of acne as well. Menstruation is another factor. A lot of people, a lot of girls would say that their acne worsens premenstrually. And of course, emotional stress is a very important factor. Various studies have been done. In fact, there was a study done on some high school pupils where their acne worsened towards the exams, and this is one of the important factors as well.
So there seems to be several contributing factors. We have a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. How are you?
Alhamdulillah, brother. What is your question? How can Dr. Umar help you?
Thank you very much, Dr. Saab. Just very quickly, one notices today that there's a significant increase with regard to vitiligo amongst many of our Muslim brethren and also some of our other citizens in the country. And obviously, at this particular point in time, it seems to be a growing trend, and there's no real, when one does research, there's no real cure for it. However, I want to talk in particular about alternative therapies that are coming out of India, Egypt, and Cuba. And obviously, many of these don't have any scientific trials with regard to the different type of products that are available. And what I would like to know is that as a dermatologist, and I know that there's various societies around the world that are looking at vitiligo, but isn't there something that we can do to try and find what alternative therapies are available and how we could try and work on this? I mean, there's been quite a few success stories of individuals going from South Africa into India or even using the treatment from Egypt or Cuba. But there seems to be that many of the medical fraternity in South Africa are a bit resistant to using this because of the fact of lack of medical or clinical trials. So isn't there something that we could do locally and try and maybe cohesively using ITB and this forum, try and call together some sort of seminar where this could be investigated? And, we're quite willing, inshallah, in some way that, through a unified whole and a holistic approach to this, that maybe we could try and find and source alternative ways of trying to take this forward, because it's a huge dilemma, especially for children and also for adults. And, for example, I received it only in my later years, and I'm now 48. I only received it when I was 43. So the reality is this, that obviously, but when one looks at the affliction on children, it causes a major pain. And as parents and as family members, we want to try and see how we can actually resolve this. Obviously, Allah subhanahu wa ta'ala grants shifa, but I think at the same time we have an opportunity to work and use our minds together to try and find a way forward. So I would really appreciate your feedback on this and how this program can maybe try and create a forum for discussion around this and actually try and create that seminar.
Thank you for that question. Very interesting. Actually, our topic is acne tonight, but I will cover a portion of that for you. Obviously, you mentioned a number of things. The alternative medicine side of it, I'm not an expert. And I can just tell you from the dermatological side, there are various approaches to vitiligo. In fact, we have a vitiligo society in South Africa, and there's a support group there as well. So maybe we could put you in touch with the vitiligo society. There are many, many modalities of treatment now available. And apart from the usual creams and phototherapy, we also have a new form of laser, the so-called excimer laser, available for vitiligo. I have heard some of my patients came back from Cuba and India, and they've used some sort of placenta extract and so on. But unfortunately, these treatments are not open to scientific scrutiny in terms of clinical trials and so on. So I will not be able to comment on that. But certainly, I can put you in touch with the Vitiligo Society, and I'm sure that if you haven't exhausted all these treatments that I've mentioned, it will be worthwhile going into the various treatments, including laser. And they may even have a comment on the alternative treatments, but I know for the fact that you're talking of the homeopathic side, and that is something for the future if you want to engage. But as I said, that's my response to you there.
Jazakallah, Doctor. No, I really appreciate it. I will obviously, we've tried the Vitiligo Society and whatnot, and obviously they're saying that, as you say, the phototherapy, or for example, when it does come out, is to basically try and take some sort of a steroid type of treatment or whatever to try and do it, but that obviously has got limited intervention.
No,
so that's why I was thinking that...
I'm talking of the eczema laser. But I think, I think you can contact me after the show and we can talk further, because I think we are going to dilute the program. We are actually talking on acne, and there are many people who want to discuss this, but I would love to talk to you after the show about further developments.
Okay, no problem. Jazakallah.
Okay.
Okay, Dr. Omar, we were talking about treatment and caring for the skin. People that have been suffering from acne, what are the best forms of skin care?
Well, what you're referring to now is cosmetics and the skin. And people with acne and acne-prone skin can use some cosmetics safely. There's a whole lot of cosmetics out in the market, but the whole emphasis should be on reducing oil in the skin. So the whole the approach to cosmetics should be one of oil-free cosmetics, and these are sometimes advertised as non-comedogenic. In other words, they don't produce any blackheads or comedones, or some of them are labeled as non-acnegenic, which means they don't produce any pimples. So it's important to emphasize that oil-free products should be the key to all topical cosmetics that you use. And cosmetics does not just include cosmetics, it includes toiletries and it includes sunscreens as well. So one should look always for oil-free products when dealing with acne.
Now, Dr. Omar, you mentioned sun-free products. Now, if we're looking at the sun protection...
No, not sun-free, oil-free products.
Oil-free.
Yeah.
But looking at sun protection, the SPF 15, the sunscreen that is available on the markets, and then the SPF 50. Can you comment on that and the benefits of the two?
Well, look, basically, I mean, there's so many different ways of labeling sunscreens, but the SPF factor is basically, the 15 factor is more than adequate for most purposes. And as long as you have both UVA and UVB blockage, you're doing okay. So, and it's important that in the context of acne, which we'll come to later, when we're treating patients with cystic and nodular cystic acne, that we need to use sunscreens on a regular basis as well.
So what is the treatment approach to acne?
Well, look, this is quite a broad question that you're asking, but I think what you should remember is that a lot of patients will come to you and say, you know, I've got acne, I'll just wait a few years and it should settle down. Unfortunately, this is a very frustrating exercise, because what happens is patients leave their acne, and what happens eventually is that they get scarring, they become frustrated, they develop self-esteem problems, they develop depression and anxiety. So it's very important to treat aggressively, well, not necessarily aggressively, but to treat early and adequately. Now, we divide treatment into two broad categories. We talk about topical treatment, which is treatment that is used on the surface of the skin, and we talk about systemic treatment, which is treatment that is given by mouth orally. What is important to remember is when you are talking to patients or drawing up a plan of action, it is important that patients realize that they should not interfere with their acne lesions by pricking, by scratching, by popping and squeezing. All these have the effect of causing scarring and permanent scarring. So that's one of the important things. And then the assessment before starting treatment, one should always check on the sex of the patient, the age. One should also worry about the fact that are the patients pregnant? Do they want to fall pregnant? Are they breastfeeding? Because all the treatment approaches would take into account all these factors. Now, to talk about the topical treatment, we talk about various creams, lotions and gels in the form of things like benzyl peroxide, topical retinoids, topical antibiotics, and also say topical salicylic acid and so on. All these work on the very early stages of acne. So when I say stages, we're talking about acne as being graded from grade 1 to grade 4 or 5. Grade 1 being the mildest form, and grade 4 and 5 being the severe nodular cystic form. So when the topical treatment we're talking about would be addressing those patients who are in the stage 1 and 2 in the early stages. Then we go on to the systemic treatments, and this would involve antibiotics, tetracyclines, erythromycin, sulfonamides, etc. These all are taken by mouth, and also in combination with, in other words, the combination therapy is with systemic antibiotics by mouth and topical gels and creams that we spoke about earlier.
Dr. Omar, what is your response to off-the-counter products in terms of treatment of acne?
Well, look, you know, we see a lot of problems with patients using over-the-counter products, a lot of abuse of cortisone creams, the stronger ones. We call them the fluorinated corticosteroid creams. There's so much abuse of those particular creams. It's almost in epidemic proportions, because there seems to be a very, very poor regulation, and these creams are sold all over the place, including at work, and you know, these are all scheduled drugs, and they should be actually only be given on prescription. But unfortunately, we see a lot of abuse of steroids, and this is a big problem in this country. Also, the various other products that we spoke about, remember we mentioned the oil-free products, and patients who using the oil products would clog up their pores and contribute towards acne as well.
We'll take a short ad break and return to Health Matters after this. Welcome back to Health Matters. The topic for discussion is acne, and we have Dr. Yunoos Omar, a dermatologist in private practice. Dr. Omar, we were talking about treatment, and one of the treatments that people often refer to is Roaccutane. What is your response to Roaccutane? What are your feelings regarding Roaccutane?
Well, yes, that's the Roaccutane. The chemical name is isotretinoin. You have different products. One of them is Roaccutane, the other one is Oratane, the other one is Acnitane. They're all generics of the same medication. This is indicated for severe nodular cystic acne, and it works extremely well. In fact, if I can have the third picture on the screen, we will show you some of the before and after pictures of Roaccutane. The next one. Next one, please. And after that? Yeah. One can see there's quite dramatic changes in the before and after treatment. The thing about Roaccutane is that there are very important precautions that one has to take. For instance, it is very important to make sure that the patient is not pregnant or is not going to fall pregnant in the next few months. There should be a regular follow-up of these patients. A pre-treatment pregnancy test should be done. And there are also a number of side effects that one should appraise the patients and tell them about these side effects. If you want, I can go into some of the side effects which are quite important. One gets an increase in certain in the lipids in the blood, and also some of the liver enzymes can be increased. The patients can experience some joint pains and muscle pains. There's also, in some patients, loss of hair, in other patients, growth of hair, and also there's a temporary worsening of the acne. And then also a lot of dryness occurs. You get dry lips and dry mouth, dry mucous membranes, dry eyes, dry nose, and all of these can be managed with moisturizing solutions and so on. And it's also important to tell patients who are taking Roaccutane or Oratane or Acnitane to abstain from any form of laser hair removal or waxing, because this can cause problems in terms of trauma to the skin.
You mentioned a number of side effects. The one side effect that I've read about is affecting mood disorders.
I'm glad you mentioned that. That is certainly something that one has to look for. There have been a lot of studies done on depression and even attempted suicides. But most of the studies that show that there is no causal relationship between the taking of the Oratane or Roaccutane and suicide itself. There is definitely some concern about patients who've been depressed in the past, or one should actually monitor the patients very carefully for depression. But at the same time, one should remember that you're dealing with a population of teenagers wherein already the incidence of depression is higher than the normal population. So this is a skewed type of statistic. But having said that, it is very important to do regular follow-ups on your patients and be alert to any signs of early depression.
We have some questions from viewers who have sent it via Facebook, and one of the questions was regarding Diane 35, birth control, and what happens when they stop that.
Well, look, that is one of the treatments as well that we haven't mentioned yet. That is taking an anti-androgen. As we remember in the initial stages, we spoke about the cause of acne, and the sebum production suddenly increases during puberty. It is the effect of the androgens on the sebaceous gland. And what Diane and other anti-androgen contraceptive pills do is they block this effect. So this is the way the Diane works. Obviously, it will only work until you are taking it, and for whatever reason, when you stop, you can resort to other modalities of treatment, such as topical treatments and systemic treatments if there is no contraindication.
Just a reminder to viewers out there, please feel free to call in on 011 086 7701 or 2 or 3. Any other advice or recommendations that you would like to make to patients out there, patients who have been affected by acne?
Well, it's important to remember that a lot of patients have reached the stage where they have acne scarring. And this has obviously been present for many years, and they may not have been taking aggressive steps such as taking Roaccutane and so on to clear the acne. So they've resulted in what we refer to as post-acne scarring. There are modalities of treatment available today for this. We have laser resurfacing, we have dermabrasion, we have surgery, there's also chemical peels, and there's other treatments involving fillers which we inject into the skin. So there is hope for patients who have this post-acne scarring. What I would like to emphasize at the outset and at the end as well is that acne is not curable but certainly controllable. And this should be, the emphasis should be to control it and so that one prevents scarring. And this is important to get across because a lot of patients unduly delay treatment of their acne, and this can result in unwanted scarring, which can be difficult to treat, but as I say, there is hope for patients now with all these new modalities of treatment.
You mentioned the modality of laser treatment. Now we know that there's lots of laser treatment happening out there with beauty therapists and aestheticians. What is your take on that? What would you advise your patients on seeking the best form of laser therapy?
Well, it depends for what indication. I mean, there are many indications for laser. There's laser hair removal, there's laser for veins, there's laser for resurfacing. Obviously, there are many people who are competent and who do it well, but there are many people who are charlatans and who are not really competently trained. So I think it's important to make sure that you get proper references when you do go to see anybody for laser treatment. It's important to ask them if they've treated anybody in the past for a similar complaint, to contact those patients and to get proper references for this, because it's an expensive exercise, and some of the side effects can be very, very devastating.
So it's important that people do their homework before they just go out and receive treatment. Another question from Facebook was regarding the redness of the skin, of the side effects of acne. What can be done? How can that be treated?
Well, you do get certain type, I'm not sure what they're referring to, but there's a condition called rosacea where one gets this red blotchiness of the skin. There is treatment available for that. One can give systemic treatment by mouth, metronidazole by mouth, and topical treatment. There's metronidazole gel, etc. So if we're referring to that, excuse me, if we're referring to that condition, there is treatment for acne rosacea. One can also get redness from many other causes, so it's important to have this assessed properly because there are many other causes of redness such as lupus and photosensitive dermatitis, etc., etc. So I think it's important to have it assessed by a dermatologist.
We have a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. I'd like to know from the doctor, he spoke about chemical peels.
Yes.
I want to know, there's a friend of mine that's having one done for pigmentation on her skin. And I'd like to know with chemical peel, what's the after effects and what's the danger of it if it's not done properly? And if she's going to a good dermatologist, how safe is it?
Okay.
Okay, just, while you're on the line, this person who's going for a peel, what is her complexion type?
She's tan.
Tanned. Is it dark? Is it dark?
I won't say dark, but tan.
Okay. Look, there are many different chemical peels, chemical agents for peeling, and one obviously has to match the chemical with the skin type, and you do. One has to be cautious, and if you're going to a dermatologist, I'm sure they take into account the skin type. But in a very fair skin, it's quite safe to use. For example, say you're going for glycolic acid, you can go 40-50%. Whereas in a darker skin, one has to be a bit careful because you get post-acne, post-peel hyperpigmentation. However, there are many other peels, and we went recently to a conference in India where the population, mostly we're talking about a tanned sort of darker skin type, and they have adapted well to using chemical peels containing salicylic acid. So there's various different peels for different skins. So you cannot make a blanket ruling on chemical peels as such. You got to take into account the individual's situation.
Okay, does it answer your question, sister? We have another caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
How can we help you, brother?
The name is Ibrahim Ismail, and I'm calling from Actonville in Benoni. I'd like to ask the doctor a question. I'm suffering with severe eczema on both my feet. And I've been to normal GPs, and also thereafter they've referred me to dermatologists. I have been to 2 different dermatologists, but unsuccessful. And I'd like to know, if there is any form of treatment which could cure this illness of mine.
Can I just ask you a few questions? Hello? Sorry. Look, when we're dealing with... hello, are you still there?
Gee, yeah, I am.
Yeah. Tell me, are both feet affected?
Gee, both feet.
Is it the feet at the bottom or between the toes or anything?
It is on the top of the feet.
Right, and what about the nails?
Nothing. The nails are fine.
Okay.
In between the toes is also fine.
Right.
It's just on the top of the feet.
Are they dry, wet, or they have got little blisters or water vesicles?
No water blisters, nothing. They're very dry. I've been applying ointment and various creams.
Is it only the feet?
Just to relieve the itch,
Is it only the feet?
It's the feet, and it seems to be spreading now to the rest of my body. In other words, it's getting towards the upper leg and my arms as well. So
the dermatologist diagnosed eczema?
Yes, he said to me it's eczema, and as such he started treating accordingly, but unsuccessful, unfortunately.
Well, look, I agree. From the clinical description that you give, it sounds very much like an eczema. Excuse me. There are many treatments for eczema, and I'm sure you've done the topical steroids and the systemic steroids as well.
Correct.
Have you had any injections into the skin?
Yes, I've had injections as well, and I think they've been cortisone,
Right. You see, so, when we talk about that type of eczema, we're talking about, control and not necessarily cure. You asked me for a cure for the eczema. I don't think you're going to get a cure, but you're going to get control of it only. And there are some stronger measures that you could take, stronger medications to get it under control under the supervision of your dermatologist. If you ask your dermatologist to please explore further options, including there's phototherapy, there may be some stronger medications for taking systemically, immunosuppressives, etc., etc. These are not without any side effects, but obviously you got to weigh the benefit to the side effect. And So I would suggest you go back to your dermatologist and try and get further clarification.
I think viewers need to understand that this is not a medical consultation as such, and will have to obviously consult with their dermatologist. We have come to the end of the show, and we would like to thank Dr. Omar for his contribution, meaningful contribution to the topic of acne, which many people are plagued by and suffer with. In concluding, we would like to end with a surah from the Holy Quran. وَالْأَسْرِ إِنَّ الْإِنسَانَ لَفِي خُسْرٍ إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. Assalamu alaikum wa rahmatullahi wa barakatuh. Until next week on Health Matters.